Let's discuss now the phobia. What is phobias? So phobias is an intense fear. It is also a persistent, irrational, abnormal fear of an object, things, situation that a person feel compelled to avoid it. What's happening in our brain, or what's happening on the brain of a patient that is having phobias? As we discussed last time in panic disorder, what region is responsible for the fear? So what's happening really in the brain when phobia is like attacking a person which has a mental disorder? So research found out that phobias often link to the region of amygdala, which is like situated behind the pituitary gland. And remember, this region is responsible for fear, emotional behavior, motivation. And it says that amygdala can trigger the release of fight or flight. Now let's discuss what is some of the common phobias of a patient which is suffering from mental disorder like phobias. So one is like claustrophobia, which is irrational fear, nyctophobia, which is fear of the night, phyrophobia, which is fear on fire, and on my top is xenophobia, which is a fear against the person from other countries. Agoraphobia is fear on situation or places. Alsophobia is fear being attacked that might occur. Aquaphobia is fear on water, while mesophobia is fear in contamination and dirt. Now, let's discuss and let's go further in a diagnostic management which will help our patients for this kind of mental disorder. Actually, there are like for the management on a therapy, there are three things that can help a patient to recover or to help their problems regarding the phobia. One is the CBT, or the cognitive behavior therapy. So let's discuss what is cognitive behavior therapy. As I discussed before in panic disorder, these are some um, professional professional person that helps the patient to recover, to talk to them, okay? But one of the common treatment of cognitive behavior is the gradual desensitization, which is like this is a treatment or a process that diminish like emotional responsiveness for either a negative or positive stimulus that is repeatedly um, exposed to it, okay? So the second one is relaxation and breathing control. The third one is some clinician, they just tend to have a test that indicate that phobia might respond to exposure therapy. So what is exposure therapy? Okay, it means focuses on changing your response in the object or in a situation that you fear. So this is like most of the management for therapeutic use for the patient. What about medicine or medication that we can give for a patient, or the doctor can prescribe for a patient with a phobias? So I have some of the medicine which is, we called it like SSRI. They are selective serotonin reuptake inhibitors. What does it mean? Okay, they are a group of antidepressant effective for treating anxiety, and they work by changing the level of serotonin in our brain and believed to control the moods of the patients. But of course, every medication, there's like a side effect of this. It includes nausea, headache, and sleep problems. So these are the four medicine that a physician can prescribe to a patient that is having a phobia. Celexa, Zoloft, Prozac, and Paxil. So these are like serotonin. Most of our serotonin inhibitors. So that ends up our discussion for phobias.